For me, the challenge, I will start from my story. To leave family and to come through where I came, and as well to go different places or different countries, and then the end when you come from the glory and the end of the place where you are, that's a big challenge. And then to become asylum in one place, and which is different people you will meet, and you will scared what is going to happen, what is happen, who is talking to me, and especially with the second language of English, that's very difficult. But still, sometimes you will say, maybe here these people they will protect me, and or not, until you find the place, you find the right way.
We cover 5 cities at the moment, Leeds, Wakefield, Barnsley, Rotherham and Sheffield. We have 3 part-time staff. Over the 3 years we've supported over 4,500 clients, and this would have been totally impossible to do if it wasn't for our incredible volunteers. And we've got over 91 volunteers who are mainly people seeking asylum and refugees themselves. And we find they make incredible volunteers because they don't want others to suffer as they have suffered. A challenge, though, has been that they don't know that they're wanted. There was actually some research done in America that said that migrants were the least likely people to volunteer, but the most likely if they were asked, because they were strangers in a foreign land. They didn't know they were wanted. And people seeking asylum here are not allowed to work and can be told they're not allowed to do unpaid work either. So they really feel unwanted. So we go out of our way to recruit them, to say, come help us. And they do. And I thought we've got somewhere when doing an interview for a volunteer, I asked, why are you volunteering? And she said, well, everyone is. And I thought, wow, then we've really got the message that you wanted, which was great. Now what we do is we have something called a volunteer pathway, through which we help people, volunteers, first of all come and have training on how to access health in the UK. And really, we learn from them as well, because we compare what happens back home when you access health, maternity or mental health to what happens in the UK. So by learning together, then we can learn the barriers that the people we're supporting face and help them to overcome it. We then have volunteers who help to interpret, to lead groups, to be health advocates, befrienders, and I have the pleasure of running a training course called Finding Your Voice and Representing Your Peers, through which people learn to grow in confidence to speak in public in English and to appreciate that what happens to them matters, and that by sharing their stories they can bring about changes in the system. So one of the things we aim to do is awareness raising, and we had a target of reaching 900 people in 3 years. We've reached over 4,500. And this is because we have such amazing experts by experience. And I'm afraid to say they always steal the show, because everyone loves hearing their stories. And we've spoken at local, regional, national and international conferences, and the volunteers have even won prizes at international conferences we've spoken at, because they are amazing.
Because the way I came, I leave my family and I came out from my family, even I escaped from prison. It was very hard. And I am Christian, and then always when we pray that we have to help to people, that's the Christianity and that's my culture. But the way I come, it was very difficult and it was very hard. And sometimes when I remember it, I think it's not true that, but to myself and to God, I said, God, if I alive and then I stay, I will help whoever, whatever, anything. From that, I started to help people, because God helped me to alive where I am now, and then I have to give to people what I find and what I learn.
The biggest block, the biggest wall in every mental health people who like me, is they refuse to go help. They think they don't need help. They think by praying, by keep God in their mind, it will be helped by itself. It will be healed by itself. It's wrong, because this is an illness. It's not something that can be miracle thing happen, you are cured. You need a medications. The medicine worked for me, and I was believed that I have this illness. And even though it's not showing on my physical, but I have the illness inside my brain, which doesn't mean that I'm crazy. I just have something like the chemical. When I went to the sessions, I understand there is a chemical that cannot be produced by my brain. So it needs help by the medicine. Medicine help to increase my low mood or something like that. So that's why it is important. Ask for help, go for help. And also now I'm working very closely with the perinatal team to create awareness on the media socials. Because we know that pandemic hit everybody world badly, so media social become the main tools for everyone. So we are in the process of creating awareness as big as we can, because we know that most of mental illness people, they not really have courage to move forward to go and meet doctor or go to GP or get a call or something. But when do the media awareness, they know this page available, and you can just discreetly message, I need help or something like that.
Most of our volunteers are seeking asylum themselves or refugees. And because the asylum system in itself causes problems with people's mental health, many are still suffering. But I have found that has made them really good volunteers, because they understand what their peers are going through. In a way, I couldn't at all. And they are able to be trusted by their peers in ways that I'm not.
I come to know that abusive behavior is happened to all the country, all the people, not only in my country. So it's everywhere. So all the victims, we are talking in the same language that we understand, because last time when we talked to those people who not really same experience with us, they will consider why you didn't go, why you stay, why you need to let yourself be abused for 5-7 years. It's not that easy. It's not something that you can just close your eyes and just walk away. It's not something like that.
I'm introduced. Before lockdown, we had these drop-ins and meetups with refugees and asylum seekers, and with HARP, and we were visiting them, trying to introduce them to the healthcare system in here, because obviously they are different. The system in here, healthcare system, is very different from my country. So these sessions that that we had, first I was doing a translator role, and after a while, which I learned more about it, I started to help people directly in these meetings. So that was part of the job that voluntarily I was helping HARP. And also in the lockdown, we had all of these race awareness meetings about different problems that asylum seekers have in general, like dental problems or like mental problems, lockdown problems that they had. Most of them related to healthcare in general. So generally, we had these meetups online, and I was helping in there as well.
I did as a health befriender. Also, I work like birth partner, and also I did with children's, with a different children's. To be honest, all the Yorkshire, I went there and I interpret. Even I was with a teenager people when they come here. I interpret them, and I talk with the social worker, behalf of the refugee, behalf of the children. I work with them with the children's section.
I work in the church, obviously, and we have asylum seekers coming through the church. We have engineers, I met doctors, I met nurses, but because of the difference teaching, they have to get the qualification in here again. They have to go through the systems, and that sometimes they just leave it because it's so make it difficult for them. Because they left everything and they came to build a better life for themselves. Some of them left because they had to, but some of them came here for a better life. So it's just finding those ability from different people. I'm sure it helps the whole country.
So then I think, am I so filthy that I am not allowed to help, even that, like, to be a part of the community in this crucial time? It was like me, I said once before that, I've been trained for my whole life to serve in an army, and when the time came to serve in the war or something, they said no to me. Like, I can see my fellows are dying, they need my help, and I'm just like shackled hands.
I did say why I was there, and then they said, oh, you could speak English, why don't you volunteer? I was like, volunteering? What is volunteering? So they explained. I was like, exactly, that is what I need. So I didn't even know what I was getting into. So I started volunteering. I went there for the day. They told me to come and then start training as a volunteer. I would say that was my resurrection in a way, because I was shocked that I could help somebody else, because I thought I was the only one who needs help. How can I help another person? So my journey as a volunteer was so enriching, and it helped me to become who I am today. So I volunteered. I was helping other people who were in the situation I was when I first came, and I did some awareness raising in the schools.
Don't want to talk to people, because I thought for people, I was just this, person from another country who was coming to ask for things. So, and I didn't like to feel like that. So that's why, if I didn't really need it, I wouldn't go and ask for things. So I would just try to stay and fix things by myself.
The first time, the apprentice uniform, it was very nice. And not only that, my mom, what she said, my dream is to be a nurse. That's always she said. And even if I'm not complete the nurse, I am there now. And it was very nice, and then I'm happy when I see that. Not only that, the important is when I see the patient, and then when I help them, if they are very happy, that means I did something, and then I will be happy. And also at the same time, different patients, when they tell you, when you talk to them, I learn from them. And when they ask me, where are you from? I'm from this. I know. This is, most of them, they said, the King Haile Selassie. I said, they know me. I'm happy with that as well. And really from this clinical support work, and not only the clinical teach me a lot of things, the confidence and the behave, and how to communicate with the different culture, with the different people, with the old, with the young. So many things I learned from that.